तो हेलो एवरीवन, अभी अपन डिस्कस करेंगे अबाउट द ट्रेनेक्सा, जिसको अपन बोलते हैं ट्रेनेक्समिक एसिड। तो बेसिकली फर्स्ट ऑफ ऑल वी नीड टू अंडरस्टैंड द व्हाट इज द मैकेनिज्म ऑफ एक्शन ऑफ दिस ट्रेनेक्समिक एसिड. So basically it prevent the basically what happen, it prevent the bleeding. So basically what it does is basically prevent the bleeding. So let's discuss about the mechanism of action of this drug. So basically it is a anti-fibrinolytic agent. It is a anti-fibrinolytic agent. Basically what it does, basically what happen in naturally when there is a formation, when there is a clot form in a body. So what body does, body dissolve that clot. How it dissolve, basically in the body there is a plasminogen. In the body there is a plasminogen basically attached to this clot and lies this clot. Basically how it lies this clot, basically it attaches lysine binding site, it attaches to the lysine binding site. After that plasminogen immediately after attaching the lysine binding site, it convert into the plasmin from plasminogen, and it break that clot. So basically what this trenaxmic acid does, basically it bind that lysine binding site. So basically what will happen, so the plasminogen cannot bind to the lysine binding site, because it already attached that the lysine binding site. So the plasminogen cannot be converted into the plasmin, and the clot lysis will breakdown of the clot will not occur. So basically this is how this trenaxmic acid work. So basically what is the indication of this trenaxmic acid, basically it we can give in a pph, and the dose is about the 1 gram IV. We can use 1 gram IV over 10 minutes, or we can use in traumatic bleeding. We can also use in traumatic bleeding. The dose is 1 gram IV over 10 minutes. After that we can give infusion of 1 gram over 8 hours, or we can second regimen, or also we can give 2 gram IV over 10 minutes, a single dose, 2 gram IV single dose over 10 minutes in a traumatic bleeding. In pph we give 1 gram IV, and we can also use in surgical cases, and we can also use this in a menstrual bleeding, heavy menstrual bleeding. And basically this is a contraindication in a when there is a thromboembolism, or when there is a deep vein thrombosis. So basically this is the absolute contraindication of this trenaxmic acid.